Good evening, ladies and gentlemen. Today we're going to be talking about measles. We're going to talk about a few of the topics will be what is measles, what's the cause of measles, hotspots like where it's most active in the world, the symptoms, risk factors, complications, diagnosis, treatment, prevention, and we're going to talk a little bit about the MMR and MMRV vaccine. What is measles? Measles is also known as rubeola. It's a highly contagious virus that only humans can host at this time that we know of. This particular virus results in a specific rash, which is also known as an exanthem. This specific rash helps determine the diagnosis of measles in children, which we will later discuss. The virus that causes measles is morbillivirus and is mainly potent around the winter and spring months. According to an article on Stanford Children's Health website, the measles virus lives in the mucus within the nose and throat. It's spread from one child to another through contact with fluid from the nose and throat. It's also spread by an infected child coughing and sneezing. Due to the type of transmission of the virus, the CDC states that the measles virus can last up to 2 hours in the air after an infected person has left. It's recommended that hospitalized patients remain in airborne precautions for a minimum of 4 days after the rash occurs. Healthcare workers should use an N95 mask when entering the room. Measles is still a very common active virus in numerous parts of the world. Since the vaccine, the numbers of infected children with measles have decreased drastically. However, when there is an outbreak of measles in the U.S., it's normally due to an unvaccinated person traveling to another country, contracting the disease, and ultimately bringing it back to the U.S., where others that aren't vaccinated contract the disease. Per the CDC, measles remains a common disease in many parts of the world, including Europe, the Middle East, Asia, and Africa. Each year, an estimated 142,000 people die from the measles. Many countries have experienced measles outbreaks in recent years. This includes many popular travel destinations like Israel, Thailand, Vietnam, Japan, Ukraine, the Philippines, and more. The CDC also states that as of November 18, 2021, a total of 47 measles cases were reported by 4 jurisdictions. Mayo Clinic states that a person with measles can spread the virus to others for about 8 days, starting 4 days before the rash appears and ending when the rash has been present for 4 days. According to an article on Mayo Clinic, the infection occurs in a sequence of stages from a period of 2 to 3 weeks. For the first 10 to 14 days after you're infected, you'll have no signs or symptoms during this time. Then you'll end up developing a mild to moderate fever with a persistent cough, runny nose, sore throat, and conjunctivitis that typically lasts 2 to 3 days. After this happens, you'll then develop a rash that is consistent of small red spots, some of which are slightly raised. Spots and bumps in tight clusters give the skin a splotchy red appearance. These spots have a red with bluish white center inside of the mouth and cheek, which are also known as Koplik spots. The face breaks out first. Mayo Clinic also states that over the next few days, the rash spreads down the arms and trunk, then over the thighs, lower legs, and feet. At the same time, the fever rises sharply, often as high as 104 to 105.8 degrees Fahrenheit. The measles rash gradually recedes, fading first from the face and last from the thighs and feet. The main risk factors for developing measles are traveling unvaccinated to countries where measles is more prominent. Mayo Clinic states that those who contract measles and have a vitamin A deficiency, the symptoms of the virus are increasingly worse than those who have a normal vitamin A level. Some of the complications that occur with the measles include bacterial ear infections, bronchitis, laryngitis or croup, pneumonia, birth defects if the mother contracts the disease while pregnant, This also includes preterm labor, low birth weight, and even maternal death. According to Mayo Clinic, encephalitis can occur right after diagnosis of measles or even months after contracting the virus. This complication occurs in 1 in every 1,000 patients. Per the CDC, laboratory confirmation is essential for all sporadic measles cases and all outbreaks. Detection of measles-specific IgM antibody in serum and measles RNA by real-time polymerase chain reaction, also known as RT-PCR, in a respiratory specimen are most common methods for confirming measles infection. These laboratory tests are obtained by either a nasopharyngeal swab or a blood sample. The virus may also show up in the urine, so if the patient is able to, have a urine test as well. According to Mayo Clinic, after an infection of measles occurs, there is minimal treatment for the infected patient. One treatment consists of post-exposure vaccination. If an infant or non-immunized patient is exposed to measles, the MMR vaccine should be given within 72 hours of exposure. If measles is contracted after the immunization, it is likely to be more mild symptoms and less duration. Pregnant women, infants, and those immunosuppressed can receive measles antibodies within 6 days of exposure, which can in turn prevent the virus from occurring or lessening the symptoms if the virus does take hold. Other medications that can be taken while fighting for measles virus is antipyretics, vitamin A, which is said to help lessen the severity of symptoms, and antibiotics if a secondary bacterial infection occurs. The best and most effective way to prevent measles is to vaccinate your children. The first dose of the vaccination in children is recommended between the ages of 12 to 15 months per Mayo Clinic, with the second dose being between 4 to 6 years. If your teenage child has not been vaccinated at this time, both doses are recommended to be 4 weeks apart. If a measles outbreak happens to occur, it is important to isolate from others. As stated in my previous slide, the MMR vaccine is the most reliable way to prevent contracting measles. Per the CDC, it is recommended children should receive their first vaccine between the ages of 12 to 15 months, with the second vaccine being between 4 to 6 years of age. The MMR vaccine is a weakened live virus. There is now an MMRV vaccine which protects against measles, mumps, rubella, and varicella, which is also known as chickenpox. This particular vaccination is only recommended for children 12 months to 12 years of age. Those who do not need the MMR vaccine consist of those who have taken at least one of the MMR vaccines on or before their first birthday and are not a high risk for transmission. Those who have lab testing and confirmed immunity from a past diagnosis of measles, and lastly, if you were born before 1956. Per the CDC, one shot of the MMR vaccine is said to be 93% effective against measles, and 2 shots is 97% effective. In conclusion of this presentation, my hope is that you know what the measles virus is, what causes the virus, where the virus is active so that you can take precautions when traveling, the signs and symptoms, the risk factors, complications, diagnosis, treatment, prevention, and what the MMR or MMRV vaccine is. Thank you.